or exactly, or another way, I am given exactly the main features, main characteristic of exactly necrosis, apoptosis, and general death. What's your...
Ma'am, I have a doubt, ma'am.
Yes.
Ma'am, actually, I'm telling that will you have any other consultation of the apoptosis and necrosis this week? Because right now I'm outside. Is it possible like to have any other class?
Maybe, but I'm not sure. Maybe next week. This week, no.
Okay,
Maybe,
in the same topic,
maybe.
necrosis and apoptosis.
If you need, if you have some question, yes, and if I have time, yes, I will
Okay,
give.
okay, ma'am. Okay, ma'am. Thank you, ma'am.
You're welcome. What else? What another questions do you have?
Ma'am, actually, about the classification of necrosis in different book and lecture and PDF, we have different classification. So just a
Because there are
brief.
too many classifications. We don't have just one classification. Yeah,
No,
we
in
have a lot of
cognitive,
classification.
they have included gangrene, infarction. So is it under
Yes.
cognitive?
Yes, I understood your question. Okay, let's start. Okay, first of all, I want to tell about necrosis, first of all. Yeah, necrosis, it is pathological death. Yeah, it means that you know that every cell has exactly limited time for life. Yeah, and the time of exactly the life of cell depends on division amount, yeah, or like a Hayflick limit. Usually it is 50-60, yeah, 50-60 time exactly cell has divided before exactly the time of the life is over, yeah. For example, we can, according to days, according to the time, yeah, we can know the time life exactly according to erythrocyte. Yeah, how much can exactly how long is the life of the erythrocyte?
120 days.
120.
120. Yeah, 120. After 120 days, exactly hemolysis, physiological hemolysis happens. It means that exactly erythrocytes are destroyed because all reserves are just exactly exhausted. Yeah. And products of this destroying are using from neighbor cells to make a new hemoglobin and another structure of erythrocyte to make new erythrocyte. Yeah. Okay. Same situation we can see in every tissue because every cell exactly life is limited, yeah, and it depends on a division exactly amount, yeah. But if something happens and cell dies before 120 day, if it is about erythrocyte, yeah, because it depends. For example, epithelial cell, usually the life of epithelial cell, skin cell, 28 days. It is like middle, yeah, prolongation of the life of epithelial cells. But it depends. Every cell has individual exactly prolongation of life, yeah. But if death develops before this exhausting reserves, before exactly end of limit Hayflick, yeah, it is pathological death, it isn't physiological death, and it is necrosis. If erythrocyte dies on 20th day, 30th day, therefore necrosis develops. Yeah, is it clear?
Yes, ma'am.
Yes.
Yeah. According to pathogenesis, how does it happen? You have to know four stages of necrosis. paranecrosis, necrobiosis, cell death, exactly, and the last stage is autolysis. First and second stage, in truth, you know, because we have studied exactly, we had topics already about them. Because in the first and second stages, cell is alive. It is exactly, it isn't healthy, yeah, already, yeah. But exactly the first stage is characterized paranecrosis stage, yeah, characterized by reversible dystrophy, reversible accumulations, yeah, which exactly we have talked already in previous lessons. Because you know, every injury, yeah, every injury, it is necrosis, dystrophy and necrosis, first of all, or apoptosis, 3 kinds of injury damage, yeah? And every of them is firstly reversible. In progression, it becomes irreversible. And if it is irreversible, it is always leads to necrosis, pathological death, yeah? Therefore, first and second stages of necrosis, there are dystrophic changes. In the first stage, it is reversible dystrophic changes, and in the second stage, we can see irreversible dystrophic changes. Yeah, tell me, please, do you remember? Give me examples of reversible dystrophic changes. Which reversible dystrophy do you remember?
Hypertrophy, hyperplasia, metaplasia.
Is it dystrophy?
Metaplasia.
Okay. Oh, okay. Oh,
Is it
okay.
injury? Is hyperplasia injury?
No, ma'am, no. It's an
No,
adaptation.
it is
It's an
adaptation. It's compensation. It happens, it develops before injury. If hyperplasia, hypertrophy doesn't help, it leads to dystrophy.
Hyaline drop.
Granular dystrophy.
Hyaline drop is irreversible.
Hydropic change.
Is hyaline drop reversible dystrophy?
No, it's irreversible. It's irreversible.
Irreversible. Therefore,
Yes.
which stage of necrosis is it?
Necrobiosis.
It's ma'am, it's coagulative.
It's
Which
paranecrosis.
stage of necrosis?
Paranecrosis. Paranecrosis.
First stage, paranecrosis stage, is reversible dystrophy. Reversible dystrophy. But we told that hyaline drop, it is irreversible. It couldn't be first stage.
Necrobiosis.
Necrobiosis.
It is second stage, but what is the first? What happens before hyaline drop dystrophy?
Granular dystrophy.
Granular dystrophy, yeah. For example, in injury, firstly, exactly, granular dystrophy, it is necrosis stage. It is reversible. If you treat in paranecrosis stage, yeah, cell tissue stays healthy. Everything will be okay. But if we don't start treatment, yeah, and this effect pathological influence continues, therefore second stage develop, and necrobiosis stage. For this example, it is hyaline drop dystrophy. Is it clear?
Yes, ma'am.
And third stage is cell death. Yeah. It will be third stage, it is necrosis, it is destruction of nucleus and other structures, which lead to stop of some function and exactly, yeah, life in this cell. It is totally stopped, yeah, in the third stage. And the last stage, autolysis, which exactly this dead cell, yeah, it couldn't stay in our organism because our organism is alive, yeah. But if necrosis develops, yeah, it means that some cell died. Therefore, we have to do something with this cell. We have to clear tissue. Yeah, we shouldn't leave our dead cells in our tissues. Yeah, who can help us to do it?
Hydrolytic
Mac-
enzymes. Phagocytes.
Who's
Phagocytes, macrophages.
Macrophages.
Hydrolytic
Macrophages.
enzymes.
Cells which exactly can engulf. What cells can engulf?
Phagocytes. Macrophages.
Macrophages.
Yeah. Macrophages, but macrophages can't engulf cells. They can engulf just particles. Yeah. And first of all, macrophages. Macrophages can engulf, and they help us. They engulf these necrotic, these dead cells, destroy it, and therefore this tissue becomes clear, yeah, because it doesn't contain dead cells. But in some diseases, yeah, diseases develop because of presence, because something wrong happened and it couldn't be cleared, and therefore patient has disease. Is it clear or not?
Clear, ma'am.
Yes, first of all, you have to understand that every necrosis develops after and because of dystrophy. Cell couldn't die before without injury. Firstly, every injury is reversible. In progression, it becomes irreversible. And just after that, necrosis develops. Is it clear?
Yes, ma'am.
Yeah.
Yes,
Therefore,
ma'am.
every dystrophy, every irreversible dystrophy leads to necrosis. It should be a rule for you. Yeah. It's happen every. Yeah. If cell is sick, if it accumulates some substances, excessive substances, it will die. It will be necrosis because this cell couldn't live total life. It will die, yeah, before earlier the normal cell. Yeah. Okay. It is pathogenesis. It is understandable. Yeah. Now, what next should you know? Classification. Yeah, you understood that exactly it is death of tissue, alive tissue in a live organism. We are talking about a live person in which exactly death of cells happens, death of tissue. Yeah, in a live organism, it is always. Yeah. According to, we can classify necrosis according to cause, according to why does it happen. It is etiological classification. Yeah, do you remember types according to etiology?
Traumatic.
Traumatic,
Toxic.
allergic,
Trophaneurotic.
Mhm.
Allergic,
Yeah.
vascular, or
Yeah,
ischemic.
Yes, of course. It is according to cause. Why does it happen? Why does it develop? According to pathogenesis mechanism, it could be direct or indirect. It means that some, for example, trauma, direct, leads to injury. Yeah? And death of cell develops. It is direct necrosis. Yeah? But indirect if exactly the cause, not exactly this cause leads to necrosis. For example, ischemic necrosis, it is indirect necrosis. Yeah, it develops because of narrowing of vessels. Vessels are narrowed, and therefore blood can't exactly move in this region of the vessel. Tissue doesn't have enough oxygen. Is it clear? Yeah.
Yes, ma'am.
Yeah. It is indirect because it doesn't happen because exactly this cause. Firstly was exactly injured another structure. Yeah. For example. Yeah. Next classification, which exactly it was given as a third classification, usually in your book, maybe in the lecture also, but it depends, yeah, which lecture. Clinical, morphological, but in truth, we should separate it because there are different exactly criteria in them. Yeah. Clinical and morphological. Morphological kinds of necrosis we have talked already in previous lessons, because exactly morphologically, how does it look morphologically after death, we can investigate this tissue, and just two morphological changes we can see in exactly according to that tissue. It could be dry or wet. Yeah, therefore two
Coagulative.
morphological kinds of necrosis. Here, coagulative, which is dry, and colliquative, which is wet. It depends on exactly presence of water, amount of water in tissues. Colliquative necrosis, usually it occurs in tissue which is rich in water. Yeah, for example, in brain, we can see always colliquative necrosis because brain tissue is rich in water. Yeah, and if necrosis happens, yeah, it is exactly colliquative, watering necrosis. And in another muscle tissue, yeah, exactly, it isn't so rich in water, and therefore predominantly exactly coagulation happens because it has a lot of protein, yeah, structural proteins here, and therefore it will lead to dry necrosis, coagulative necrosis. Just in situation, yeah, in the muscle tissue, for example, in skin, yeah, which according to this characteristic, it should be dry necrosis always. But if, for example, some infection happens, it means that in presence of microorganism, bacteria, which can exactly lead to exactly edema and liquefactive changes in tissue, yeah, in infection complications, yeah, in the skin can develop, for example, exactly wet necrosis, colliquative necrosis in infection diseases very often. Yeah, is it clear?
Ma'am, can we say that wet necrosis occur due to enzyme, like enzymatic process can occur?
Yes, but not enzymatic process, because enzymes exactly work in every necrosis. But if too much enzymes accumulate in necrotic tissue, yeah, this necrotic tissue, because of presence of enzymes, absorb water in it, yeah, and therefore watering of that tissue happens because of presence enzymes. Is it clear?
Okay.
Usually pH is changed, yeah, because of enzymes presence, and it leads to absorption of water in it. Okay, colliquative and coagulative necrosis, two kinds of necrosis, morphological, yeah, but according to coagulative dry necrosis, you have to know a few specific kinds, yeah. Coagulative dry. In some diseases, we can see very specific morphological changes of the tissue, which can help us to recognize disease, if you even don't know. Yeah, there are three kinds of necrosis. It is caseous necrosis. Yeah, caseous necrosis. In this necrosis, necrotic tissue, it has whitish grayish color. It's dry, grainy. It looks like cottage. Is it clear?
Waxy, do you mean?
Waxy.
Waxy?
No, caseous.
Cottage, we know it.
Looks like a cottage cheese.
Yes, we understood.
Done. Cottage.
Mhm. And it occurs in infection diseases like tuberculosis. It's very specific for TB. Always in tissues. In tuberculosis, we can see this caseous cottage-like dry masses. Yeah. In syphilis, in Hodgkin's lymphoma. It is malignant tumor of lymphoid tissue, and it occurs in lymph node. And in lymph node, we can see this caseous necrosis. And next, coagulative necrosis. It was exactly about caseous necrosis. Do you have questions about caseous necrosis?
No.
No, you have to know characteristic, yeah? How does it look like exactly? And what diseases, examples of diseases. Next, coagulative necrosis, dry necrosis, develops in muscle tissue. It is waxy necrosis, yeah? It is exactly in muscle tissue, muscle fibers. Usually they are striated, yeah? They have striated exactly a composition from myofilaments, yeah? But if necrosis develops, they become homogeneous. They lost usual striation, and they look and become very hard, dry and hard. And these muscle fibers, microscopically, they are homogeneous, pink color, and looks like waxy candles, Therefore, they have this name. It has this name, waxy necrosis. Is it clear?
Yes.
Yes.
This
Okay.
is, sorry,
It
doctor.
occurs
Doctor,
in
wait.
muscle.
This is coagulative necrosis of the muscles.
Yeah.
The dry necrosis. And clinically, the name is waxy necrosis.
Not clinical. It is morphological.
Microscopic.
Microscopical and morphological, it is waxy necrosis. But don't be confused, because in muscle tissue can occur coagulative necrosis, not waxy. Exactly, coagulative necrosis. But for example, in myocardium, it is dry necrosis. It doesn't have specific feature. It isn't waxy necrosis, but it is coagulative necrosis. Now I am given specific kinds of coagulative necrosis. There are like additional subtypes. Is it clear?
Yes, doctor.
Yeah. And waxy necrosis develops in muscle tissue, in skeletal muscle tissue, in abdominal wall, for example. Here, very often it occurs in typhoid fever, in cholera, in diseases which are characterized by losing of water, dehydration. Yeah, when dehydration, exactly when patient lost a lot of water, infection disease, which is characterized by losing of water, we can see waxy necrosis in muscle tissue, but only in muscle tissue, specifically. And the last kind, morphological coagulative necrosis, it is fibrinoid necrosis. Fibrinoid necrosis, it is outcome of fibrinoid swelling. Yeah, do you remember? How does it happen? Yeah, firstly it was mucoid swelling, in connective tissue develops. Yeah, in progression, mucoid swelling leads to fibrinoid swelling, and fibrinoid swelling, which is characterized by fibrinoid, yeah, which is dense compound proteinal masses, yeah, and it leads to necrosis of connective tissue, and it is exactly fibrinoid necrosis. When can we see fibrinoid masses? We should find microscopically in it. When exactly can it occur? It can occur in malignant hypertension, in vascular wall, exactly, it develops. If patient has right now, malignant hypertension, suddenly was increased arterial pressure, and patient has a few hours, he has, for example, 220, on 120 arterial pressure, systolic 220 and diastolic 120, for example. This hypertensive crisis, this malignant hypertension. In progression, after a few hours, in the vascular wall, exactly develops fibrinoid necrosis. And if it happens in brain vessels, it leads to stroke because of rupture, because this vascular wall, in which necrosis develops, can be ruptured, and hemorrhagic stroke develops, which can lead to death. Therefore, if patient has exactly very high arterial pressure, we have to decrease immediately. We have to use drugs or inject some medicine to decrease arterial pressure, to prevent a necrosis in the vascular wall. Is it clear?
Yes, ma'am.
Yes. Also, for fibrinoid necrosis, we can see in allergic reaction, in autoimmune diseases. Also, it can occur. Lupus erythematosus, rheumatic fever, and another diseases. According to colliquative necrosis, you have to know as a subtype, colliquative, but sometimes it could be dry necrosis, but it is usually it is colliquative necrosis of fat tissue, adipose tissue. It is fat necrosis, which occurs in pancreatitis. If patient has necrosis, not necrosis, inflammation, injury, exactly of pancreas, because of injury of pancreatic tissue, lipase exactly appears in bloodstream. Lipase, it is enzyme which can destroy fat and fat cells exactly, yeah. And lipase destroy adipose tissue, and patient has exactly fat necrosis. Yeah, it is like injury, rupture exactly of adipocytes and injury of adipose tissue. Okay, it is morphological classification. Is it clear?
Ma'am, fat necrosis is an example of colliquative or coagulative. Coagulative, sorry.
It depends, because sometimes this exactly fat tissue injury could lead to dryness of it, and sometimes it could lead to a colliquative changes in fat tissue. Therefore, it depends.
Okay, ma'am, thank you.
If you are basically
You have
talking
to
about
know a specific kind.
if you are basically talking about pancreatitis, only pancreatitis, not including the fat covering. So what will it call then? Because fat is not involved. If it's necrosis of the only pancreas, only necrosis of pancreas, not the fat, then it will also called fat necrosis or not? Because fat is not involved in it.
Why fat not? Pancreas, one of the function is pancreas has a lot of function, but the most important and the main function of pancreas, it is it's producing of lipase. Lipase, it is enzyme which can destroy and which exactly destroys fat. Yeah, you know it.
Yeah, I know it.
And if pancreas is injured, too much lipase go in blood and spread it in all organism from blood. From blood, it exactly goes in every adipose tissue, because it is close to adipose tissue exactly. It goes where adipocytes with fat cell which contain too much fat. This enzyme exactly goes in it and destroy it. Is it clear?
Absolutely.
Patient has pancreatitis, but pancreatitis can lead to disappearance, to cachexia. Why? Because exactly this lipase destroy all fat tissue. And after pancreatitis, if patient stays alive, unfortunately, very often acute pancreatitis leads to death. But if patient stays alive, very often he has cachexia, because all adipose tissue was destroyed and it was disappeared. Is it clear? Okay, it is morphological classification, yeah? And next, the last classification, which exactly you have to know. Yes, I think it is last. Clinical forms of necrosis, yeah? And in your book, very often you can see combination, clinical, morphological, yeah? And you can see coagulative, colliquative, and next, gangrene, infarction, and sequestration. But gangrene, infarction, and sequestration, there are clinical kinds of necrosis. It is clinical forms, clinical classification, because we can identify gangrene, infarction, and sequestration in clinic. Yeah, surgeon, pediatric, another clinical doctor can identify infarction, gangrene, and sequestration. Is it clear?
Also, we will include infarction also.
Three clinical clinical forms: gangrene, infarction, and sequestration.
Okay.
Is it clear?
Yes, ma'am.
Morphological, which exactly we have talked already, yeah? Morphological necrokinds can identify pathologist only. Pathologist after autopsy or microscopical investigation. But clinical forms, we can investigate exactly in a live person, yeah? Clinical doctor can identify gangrene, infarction, and sequestration. Is it clear?
Yes,
Yes,
it's
ma'am.
clear.
Mhm. About every of them, yeah? Gangrene, first of all, about gangrene. Gangrene, it is a necrosis of tissue. Tissues have contact with environment. Therefore, it is necrosis only in tissues which have contact with environment. Yeah. First of all, it's exactly our outside tissue, skin. Yeah, because it has contact with environment. Yeah, therefore it can happen, can develop exactly. Yeah, gangrene of foot. Yeah, and exactly, and other regions. Yeah, and our internal organ also have contact with environment. Yeah, for example, what organs are having contact with environment? Internal organs, I mean.
Lungs.
Lungs.
Lung, respiratory, all respiratory, yeah, tract. Lungs, bronchi, trachea, but yeah, first of all, we are talking about organ, yeah, as the main organ, lungs, gangrene of lungs, it's possible. Okay, what else? What another organs also have contact with environment?
Stomach.
Gastrointestinal tract, from oral cavity till
Rectum.
yeah, till anus, exactly, yeah. In the intestine, in stomach, in esophagus, everywhere can develop gangrene if necrosis develops in it. Yeah, it will